There was a case of a liver transplant. It was a 50-some-year-old gentleman. Everything was actually going pretty smooth. I don't know if I would call it Cadillac, but it was certainly one of those where you're kind of, you're kind of thinking, all right, great, I'm going to be home in a couple hours and, I'll make dinner. Turns on a dime. We got the new liver in, we reperfused it, and that's when we put, let blood flow back into the liver. And all of a sudden, instead of everything kind of going smooth, the patient's pressure dropped, and the liver became severely congested. There was a small injury, laceration of the liver during the donor procurement. Well, that laceration, which wasn't bleeding at all, because of the back pressure, we just put lap pads with pressure, and usually with the liver you can kind of compress things. Even with that, it was just soaking through the lap pads. And so that's when we said, we called for EVARREST, we got it in the room, and we opened it up and we applied the EVARREST on there and then put the lap pads on there, applied that and held pressure, and then after that, it wasn't bleeding at all anymore. So now we had a major problem of bleeding in that area that we had solved in short order, which allowed us to kind of continue to find, okay, what's the real etiology of all of this? And then we could kind of deal with the true problem, and then the liver did okay, and the patient did fine. We got him off the table. He actually didn't have too many bleeding issues after that, and he did well, went home. Benefit that EVARREST applies compared to its cost or compared to the time that it takes to apply it, I don't think that the effects of it can't be disputed.